You're welcome to my channel. I know you have clicked on this because you want to know more about Edarbyclor. Some call it Edarbyclor, but I will call it Edarbyclor. Before we move further, I'm saying thank you for visiting this very channel. Please remember to subscribe if you haven't. If you have subscribed, I'm saying a big thank you for visiting again. Okay, let's go and know more about Edarbyclor. Okay, the first note here is like the window to the entire presentation. So we will know that this tablet has two medications. Okay, so two medications in one tablet, that's what we're dealing with. These will not be effective immediately. So if someone has hypertension and is on this medication, you are not going to pick, good effect immediately. It's going to take about 2 to 4 weeks. We cannot use this tablet in anyone who could not produce urine or producing low level of urine or having difficulty urinating. No. In someone with hypersensitivity to sulfonamide, because one of these two medications, clothalidone, is a sulfonamide derivative. So we will not be comfortable to use it in such a person. Although the cross activity is pretty low, but then we will not take that risk. In pregnancy or breastfeeding mothers, no. In anyone with refractory hyponatremia or there's hyperkalemia, no. In fact, one of these medications, the ARB component, can give hyperkalemia. When the kidney function is bad, no, we will not give this tablet. So the kidney function must be pretty good before we can give this medication. And anyone on this medication who had not developed sight problems before or ocular-related problems or eye-related problems, now he or she may develop it, particularly if on name for a long time. Truth be told. Okay, so we will then go into details of all this right now. Now, Edarbyclor is a combination of two drugs, like I've said, azilsartan and clothalidone. Don't worry, I'll tell you more about them. This medication could be under different brand names, depending on the one available in your jurisdiction. Could be Edarbyclor, Edarclor, azidozomil, Stanzil Plus, Zatalidone, or Zacus, depending on which one is available in your jurisdiction. It belongs to the class of medications known as antihypertensive agents. The azilsartan component is an angiotensin receptor blocker. Remember angiotensin converting enzyme inhibitors, right? All those right? Clothalidone is a water pill, specifically the thiazide diuretic. Forms. The only form is tablet. You can only find Edarbyclor in form of tablets for oral use and can come under different strengths, like Edarbyclor 40/12.5 or 80/12.5, meaning azilsartan is 40 mg or 80 mg, while clothalidone is 12.5 mg or 25 mg. Usually, we use Edarbyclor 40 mg azilsartan and clothalidone 12.5 mg mostly, then you increase with time. Administration. You can give this medication with or without meal. Uses. Helpful in the treatment of hypertension. And it's also useful when monotherapy in handling hypertension is not doing a great job. then you want to combine another medication, right? Remember, if you have checked through my channel, there's a separate presentation on hypertension. I tagged it hypertension A to Z, more than 2 hours. There I've stated the different classes of antihypertensive agents and when you can use them. Mostly we'll start with now water pills, diuretics. So if it's not winning and you want to add another agent, then you can grab Edarbyclor. Or when a patient doesn't like taking two medications separately, so you then look for one tablet that could contain two different types of antihypertensive agents. In that case, Edarbyclor could be a pill. Drug-drug interaction. Because the list could be pretty long, and I may not be able to say precisely which ones you may use or may not use, so I'll leave that to your pharmacist, your clinical pharmacologist, and your physician. Monitoring. Please, we must know the blood pressure. Remember, this medication is meant to handle hypertension and will expect the blood pressure to drop. That must not drop too much because we have to titrate this medication with the value of the blood pressure. So it is compulsory to know the value of the BP, the heart rate, and of course the renal function test. Why that? You know in a bit. Then fluid in and out. We must monitor that. Why that? I will say more in a bit. In Italy, and someone will ask, why are you, so concerned about elderly different from the rest people? Well, it is extremely important to monitor the level of sodium in them. In every patient, but more in elderly. Now, the mechanism of action. How would these medications help bring down the blood pressure in our body? Azacitidine, like I've said, is an angiotensin receptor blocker. That will block the conversion of angiotensin 1 to angiotensin 2. And remember, angiotensin 2 is a very strong vasoconstrictor. It will do this by selectively binding to AT1 and AT2 receptors, thereby inhibiting the vasoconstriction and aldosterone secreting effects. The clothalidone, the known water pill, or specifically thiazide diuretic, is a sulfonamide-derived diuretic that has the capability to inhibit sodium and chloride reabsorption in the cortical diluted segment of the ascending lobe of vein of the kidney. Contraindications to the use of Edarbyclor. Anuria. The patient is unable to produce urine. No Edarbyclor. Oliguria. Decreased level of urine or difficulty urinating. Please keep this medication off the table. Or someone is a diabetic patient on Aliscurin. No. Someone that is having hypersensitivity to one of these two medications, the ARB component, that is azacitidine medetomidine, we will not give it. Another person is sensitive to clothalidone, we will not give it. Someone is sensitive to sulfonamide. Remember, clothalidone is sulfonamide derivative. Although the cross hypersensitivity from antibiotics to this is low, but the fact that it is present means we should be careful we don't use it. In pregnancy and breastfeeding, keep this medication off the table. In refractory hyponatremia, I will not give it. And in pregnancy, please stop. Stop what you are doing. If you are confused, you are not sure this person is pregnant, then help that woman and help yourself. Do blood woman cloning gonadotrophy. If it is positive, don't use Edarbyclor. Why that? There may be fetal death. Why would there be fetal death? That will occur from disruption of renin-angiotensin system. Clothalidone, with or without allocytin, could be present in breast milk, and that is not good for the breastfeeding mothers. Adverse reactions. Hypotension. Of course, any medication that we use to treat hypertension is expected to bring down the blood pressure, but to the level that will allow the patient to still enjoy his or her life. Okay? There may be dizziness, fatigue, increased blood urea nitrogen and creatinine, angioedema in less than 1%, nausea, pruritus, skin rash. Other adverse reactions will include photosensitivity and ocular problems. There may be constipation, muscle cramps or muscle spasms. There may be decreased libido. There may be abdominal upset with decreased appetite and sometimes syncope. It doesn't mean everybody taking Edarbyclor will definitely have this, no. But some will experience one or more of these adverse reactions. One, I will go through certain pieces of information right now that we will need to have at the back of our mind before we start taking this medication, or if we need to already, whether we need to have that discussion with the physician right now or the pharmacist right now, we'll see. Okay, let's go through some of the warnings when it comes to Edarbyclor. Now, the warning is proper. Although this medication has clothalidone, a thiazide diuretic, and we expect that to drop or bring down the level of potassium, hypokalemia, but that will be less profound here. This is not potassium-sparing agent like spironolactone, amiloride, or trimethoprim, but because there is ARB, angiotensin receptor blocker, in this combination, then the rate at which potassium will drop will be less significant. In fact, we may even run to hyperkalemia. So we have to follow like hawk, follow up the value of potassium here, because ARB can actually shoot up the value of potassium. And we are going to be dealing with hyperkalemia in the face of renal impairment. Still on warnings, we must watch out for hypotension and volume depletion. So we need to know volume in and out, skin turgor, dehydration, blood, pressure, and so on. There may be worsening of renal disease or an onset of renal failure can be the case if there's actually heart failure already with volume depletion or renal artery stenosis. Clothalidone may lead to photosensitization. Sulfonamide allergy cross-activity with antibiotics that contain sulfonamide is very low. The fact that it's very low doesn't mean we should overlook it. We should be careful. That's why we call it warning. Now, still on warnings, we have to be careful when we're using clothalidone in anyone with dehydration. Why that? Clothalidone is a diuretic that is expected to send out the fluid. Someone is dehydrated and then you are still sending out more fluid, then the situation will be worse. In diabetic mellitus, we have to be careful when we're using clothalidone because clothalidone can actually increase the glucose level. Then, the other hypoglycemic agents or insulin will appear to be ineffective. But the actual problem is because clothalidone is shooting up the glucose. In gout, someone with gout will not have the relief when we're using clothalidone. And remember, this one tablet is containing clothalidone also. So, clothalidone component of this tablet has the capability of increasing the uric acid. In hepatic failure, the hepatic impairment may lead to electrolyte imbalance and also acid-base dysregulation, and of course, hepatic encephalopathy. In hyperkalemia, clothalidone on its own can increase the level of calcium. So, someone is having hyperkalemia, and then you are given this tablet that contains clothalidone, we will never get out of the trouble. In hyperlipidemia, it will appear as if the medications we are using to handle this and diet control is not successful because clothalidone can in its own increase the level of cholesterol. In hypokalemia, in fact, it will be risky not to know the value of potassium and get that corrected before starting anyone on this medication because hypokalemia is expected with clothalidone. We expect the clothalidone to send out the potassium, and now there's hypokalemia already, then we don't give this tablet. In systemic lupus erythematosus, we will not be comfortable to use it because the clothalidone component can actually worsen systemic lupus erythematosus. In anuria or renal failure, as a matter of fact, we must not use this tablet in these situations, meaning this tablet is actually contraindicated in anuria or renal failure. Still on warnings, as a certain component should be used cautiously in the face of aortic stenosis and mitral stenosis. And since these two medications are in one tablet, it means we cannot use this tablet in aortic stenosis and mitral stenosis. Still on warnings, now ocular problems. Some diuretics like clothalidone and hydrochlorothiazide can actually increase the chances of choroidal effusion. They can lead to acute myopia and acute angle closure glaucoma. Okay, anyone taking this medication should be extremely careful and report to the physician, and the physician will send referral to ophthalmologist immediately. Example of when we can use Edarbyclor is in hypertension. You can give 40/12.5 milligram once daily, meaning the ARB component, that is azacitidine, will be 40 milligram, and the clothalidone will be 12.5 milligram. This is the one we use mostly, and you use that for 2 to 4 weeks. If you are not winning, you can then increase the strength to 40/25 milligram once daily, depending on what your decision is. Some will now increase the dose of the ARB, and some will increase the dose of, clothalidone. But I would rather increase the dose of clothalidone first because the diuretics will help. It depends on what you are battling with. If the value of potassium is becoming worrisome, is giving you hyperkalemia, you will not want to increase the dose of the ARB. Okay, with that, I've come to the end of this short presentation on this very one tablet that contains two powerful medications to deal with hypertension at the same time. Thanks for listening. Please go through this again. Remember to subscribe to my channel. Remember to share this. I appreciate it.